I'm really looking forward to getting this laser treatment taken care of and gotten done before I go in to have my FFS done in May.
Yeah.
So
now that's actually seems to be working out. I seem to be getting a little bit less fur showing up on the face.
You have to use fur. Teddy bear. No, you don't. Oh, I did not just say that. Oh.
So how did your little bout with the laser turn out this last time?
Actually, they used that clear numbing cream last time and it was much better.
Yeah.
It wasn't. It was more tolerable.
Yeah.
So.
All kidding aside, yeah, that numbing cream does seem to help out.
It helped a little. Oh, we're not.
Are we recording?
Yes, we're recording.
Oh. Welcome to our viewers on YouTube, Facebook, and on the Genderblenders channel. We have a treat. Again, we have a open topic week.
Yes.
And that means we get to discuss anything that my dear sis and I want to talk about.
No.
So this week we're once again going to discuss various topics. And we welcome comments from all of our awesome viewers out there.
Definitely. As we mentioned the last week, in medical transition we go through many various changes, feelings and emotions. We face many different requirements needing to be accomplished in order to progress on to further steps toward the goals of completing ourselves to a goal that we have set for ourselves. Many of us refer to, these as final steps in transition, though we know, as we all know, there's no such thing as the final step in transition because you don't stop transitioning.
Sis, as well as there are many methods that we can use to identify ourselves.
Yeah, that's right. Question is, where and how do we begin transition? Besides going through all the legal matters involved in correcting our documentation, there are many avenues which we mix up and accomplish to change all of our physical appearances to match our identities as far as our correction is concerned. And that's one of the purposes of our transition in the first place is to correct ourselves.
So let's discuss the many forms of achieving a medical transition.
Okay, yeah, it'd be fun.
So HRT is just the beginning of transition.
Mm-hmm.
If you begin at an early age, your body makes many of the changes, the corrective adjustments, without the need for many additional surgical things.
Yeah, interventions.
Surgical interventions. And those surgical interventions, therefore, for young people, really, they have an advantage. It's really not necessary.
Well, for those who are older, there are less automatic changes in your physical appearance that occur. An experienced trans specialist is better, as a better choice over a standard medical doctor because he can adjust things for age appropriateness, so that you stand a better chance of seeing those physical appearances or physical changes during medical transition. So, many of these corrective surgeries, are, mostly as you begin in the beginning stages of your transition, are facial feminization surgeries, which there are a lot of different varieties of things that you can have changed about yourself to make yourself both appear better and to give you more confidence in yourself. And that's more prevalent in the older age groups, where that is dependent upon when you started your transition. There are many different choices that are available for seeking corrective surgery or corrective measures, and these methods, you can start off with go work down from the head above.
Yeah. So for hair, we get eyebrow kind of shaping.
Yeah.
So we do pluck our eyebrows, and sometimes we do waxing on them. So there's a lot of things there. There's a lot of kinds of intervention that we can use for hair to get, to shape our eyebrows so that they look more feminine, look more natural.
Yeah.
There's other facial and bodily hair that we also need to get rid of.
Well, some prefer to use electrolysis or laser removal, or a combination
or even
of both.
Combination, yeah.
Yeah. So there are other surgeries that begin with our, that begin with a lot of our facial. You can have that begin with facial changes. Depending upon whether or not you are male to female or female to male. Different types of things, surgeries and stuff that you can have done to your face. Some people, girls, don't even have any done because they, when you're taking testosterone and stuff, you start growing, facial hair and stuff. For the female to males. But it's a lot different for us girls who are male to female, transsexuals or transgender people. A lot of it is facial contouring or what's known as FFS, facial feminization surgery. So a lot of us have to go through that because we didn't start transition until later on in life, and we have suffered a lot of testosterone damage that needs to be corrected. Which is possible, especially when you can afford it. These are things that you need to look at.
There's all aspects of our face that can happen. We have forehead, very much forehead kind of a thing. Eyebrows. There's a combination of surgeries and procedures that we can use to follow here. Hairline, receding hairline is like one thing that can happen. If you're older and things like that, you get male pattern baldness kind of a thing.
Receding hairline correction, that can be performed with hair transplantation, which is one of the procedures we hear about, or the procedures of scalp where they actually do what's called scalp reduction, which basically is where they cut your skin and shorten, take some off and move your hairline forward. Then you have
nose feminization.
Yes, also known as rhinoplasty.
Right.
So
it comes from the rhinoceros.
No, it does not. He's got one big tooth sticking up out of his nose.
Yeah, that's one heck of
one big mistake he made, doesn't he? He chewed down too hard, chomped down so hard, this one tooth went up to his nose.
That's right.
Came out. No, rhinoplasty is a surgery to the nose. And that can be performed in many different ways. Some people want to get rid of the big knob they have out in front, and some people need to have them shortened, some people need to have it totally restructured, or your sinus plates and stuff need to be brought down, which is like what I need to have done. Some people need to have their nostrils and that slimmed along with their nose slimmed. We have to give them that feminization look.
Then after the nose surgery, not after, but as well as nose surgery, you can have jaw feminization, and they'll take and can shave, if you have a very pronounced jaw. They'll take that and shave that down.
Yes. But the jaw is measured from here back to here on your face, and if that line is too long, they can shorten that up. Okay, and that's part of what's called jaw feminization. Here is what is the chin feminization part, where they readjust your chin. Because if you ever feel up here, you have a big distance from each hair and the back side of that bone, so it's pretty thick. So there's a lot they can do here to take a lot of that off without any bad repercussions. And a lot of times they'll remove some of the muscle and or fat part out there too, so that it lays down fast. And a lot of this requires bandaging, it being held in place while you're healing for the first 4 to 5 days. and then they can remove the bandages. The other thing is cheek feminization, which basically is done with either a fill or an implant. And sometimes they even do an implant right here in the chin. But they, if a lot of people, and you don't have them because you can see I do here and here, I have the girl cheeks. And a lot of them are not as prominent.
Yeah.
And they can do a fill in here to basically feminize your face. Another good one, which would be
brow lift feminization.
Which is very common. You hear about that. Girls doing that. And that's where basically they make a small incision on both sides at the hairline generally and just raise the skin up here without creating any physical wrinkles. And it raises your brow. Yeah, and it raises your brow line up and gives you, or they can make a slight incision just above the eyebrow and take some of that out and then sew it back on, and it gives you an automatic brow lift. And it's hidden because the scar normally is right about the hairline of your brow, and that's one of the other possibilities of things that they can do.
Facelifts.
Facelifts.
Facelifts have.
They have both small and large facelifts.
Right, and that's one of the things that I'm actually going to get done as well.
Yeah.
So it'll get rid of some of the parentheses here, and get rid of some of the wrinkles around my eyes.
You're getting rid of some of the wrinkles, especially around your eyes and underneath your eyes. And that's typical. A lot of women do that.
Yeah.
A lot of women get facelifts, so that's not uncommon for us girls.
Yeah, and you can kind of see some of the sagginess and things like that.
Yeah, and one of the other methods for tightening up your skin if you're young like myself or whatever is the chemical or laser skin etching.
Yeah.
Or even for you, it will tighten your skin up and make it smoother. Give you a smoother complexion as well as tightening your skin up, and that takes a lot of age off of you. That's for sure.
Yeah, it does. And you end up getting that.
But it's more intense. It's more involved.
It is. It's more involved, but you end up getting that. Like you can only do it like every couple of years or something.
Every 3 to 4 years.
3 to 4 years.
Yes. Yeah. And then, what is the other? Oh, the other one is lip plumping.
Yeah.
Or a lip lift.
Yeah.
Which is generally done on the upper lip. For people who have a real small upper lip, they can literally make it it's called a crossbone incision right below the nose area, and cut right through the muscle, something like that, and then you raise that up, and it creates more of a fleshy look and more of a lip, your lip look. And if that's not all that effective, even though that is one of the things that they do, then they can also go in and give you injections.
Get some injections and pump that up a little.
And they can pump it up a little bit. Correct. Yeah. So that's one of the other things they can do. Another more common one amongst those who have a lot of testosterone damage. But I don't have that. So
yeah, you don't.
But is having your Adam's apple reduction, which I don't know if the rest of my family can see. I don't have that.
She's lucky. She doesn't have that.
Cue card, you know what I'm saying?
Yeah. I
ended up with that, have that. I mean, yeah. So, having your Adam's apple reduced is another common procedure and stuff that we do for facial feminization.
Yeah. And actually that's part of the facelift thing here too, if you notice. In addition to this stupid Adam's apple, I have an awful, you can see the big...
Yeah, I can see it. And see, I don't have that. I don't know where
she doesn't.
It's not there. I don't have it, so...
Yeah, she doesn't. Your neck is perfectly fine. It's...
Yeah, I don't know. I sit there and look for it going, hey, where's mine at? And I don't have one. So, so I was lucky with that one. I didn't get that either. So that's another part of the girl part that was in me already.
Yeah.
And I didn't have receding hairline,
right.
Or male pattern baldness.
Right.
Like all the rest of my brothers and cousins and uncles. And,
that's another clue.
Yeah, my father bald as a bear. All my brothers are. This is my hair. This is not a wig. It don't come off.
I've never seen a bald bear.
Oh, bald as a bear? You ever see one?
No.
Oh. Well,
That's
voice surgery, they don't want you to talk for a month. You have to write everything down. They don't want you using...
Wait a minute, a girl not being able to talk for a month?
Yeah, a lot of girls are very serious about needing to have that surgery.
Oh, yeah.
So, I mean, you know, all fun aside, voice surgery is a very, very, and right, when it comes to voice surgery and also rhinoplasty, those are two pretty intense surgeries to go through. You know, there are other options as far as, you know, transitioning stuff is concerned, and feminization of your body.
Waist training, that's one of them, and that's where you can have a form-fitting body corset or other form-fitting things that aren't quite corsets, but they're just really waist trainers.
Right.
Some of them you can get directly off the shelf at like Walmart and things in places like that.
Right.
You can get. You can also get custom-made corsets, or you can buy corsets off the shelf to help train your shape. And then there's some additional things that there's some additional procedures that we can get done to us.
Physical?
Physical things. Besides, of course, the gender corrective or SRS.
Well, you know, a lot of girls do that. Breast surgery.
Breast surgery.
Yeah, a lot of girls get that. And that's becoming more and more and more popular. But you want to make sure that you're getting some that are made with a good product. You know, make sure that you're using surgical, grade.
Surgical grade
Silicone. Yes, they are actually breast implants are an envelope, a sleeve that is filled at what they put them in, get them in place, they fill them, and that gives you that lift, gives you that better breast appearance. I don't need to have that. Mine are quite real. Thank you very much. Happy with that. But you know, they fill them with both silicone and the two common uses or fills are the silicone and saline solution. Yeah. So the other two surgeries, of course, are SRS and or GCS or gender corrective surgery, which basically is for transsexuals, because transsexuals are actually female on the inside, and they can form better. It's because being transsexual is a precise medical condition from birth, and depending upon how much you have, and you can find these things out. I mean, there are a lot of traits and stuff like that that are common to transsexuals that are not common to the transgender people. So transsexuals have what's called gender corrective surgery. They get themselves corrected to the appropriate sex which they identify with, because that is what they are and who they are inside, and it needs to match. Some of them might have various parts, additional parts besides just having a female brain, like myself. So it depends upon the extreme of the transsexual. So that's about all I have for today, sis.
That sounds pretty good. I have nothing else to add.
Okay.
So until next week, everyone.
Yes.
I'm Steffi.
And I'm Stephanie. Have a wonderful day.
Bye-bye, everyone.